Queensland has recorded no new coronavirus cases on day one of Brisbane's lockdown. The state battle with the UK strain is far from over after a new risk emerged.
It was positive news for more than 2 million Brisbane residents who woke up in lockdown.
Late yesterday we were notified that a case that had been confirmed in Victoria had moved up to Queensland, and the genome sequence result had come back and she was positive for the UK variant.
The woman travelled from the United Kingdom to Victoria on Boxing Day, testing positive to coronavirus 1 day later while in hotel quarantine. She was released after just 10 days and caught Jetstar flight JQ 570 from Melbourne to Brisbane on January the 5th, landing at 11 p.m.
Then she travelled up to Maleny, where her parents live, and she's been staying with her parents. So her parents have been tested, and we're working through any close contacts that need to be looked at.
On Friday, she was retested in Queensland out of an abundance of caution.
The risk is extremely low, very, very, very low, because she is right at the end of her potential infectious period.
Victoria says it was following national health guidelines, having released the woman without an exit test and prior to the completion of genomic testing.
That is was the AHPPC national system that all jurisdictions applied, and now as a result of the changing nature of the infectivity of new and emerging strains, out of an abundance of caution, that system has been toughened, and that's a decision that we've both implemented and welcomed.
An issue New South Wales has also grappled with as more cases of the UK and South African strains emerge in hotel quarantine.
And what the guidelines were is that you needed to have, for mild cases, you were able to be discharged if you were 10 days from your symptom onset and you had been free of symptoms for that 72 hours before. And the reason that was necessary is that we know that we have found cases where you can detect the virus in people's noses and throats 3 months and even 4 months after the infection.
Queensland Health has identified 91 close contacts of the hotel cleaner who sparked the 3-day lockdown. They've all tested negative to the virus and are in quarantine.
Let's see what happens on Sunday. Let's see what happens on Monday. These are the crucial 3 days that we need. And like I said, the whole country is looking at what happens here in that Greater Brisbane region, because we know that this UK strain is incredibly contagious. This is the first time it's been out in the community, and it's not to say it's going to be the last.
Queensland Police is cracking down on anyone who isn't adhering to the stay-at-home order or wearing a face mask. They'll be conducting random intercepts of people right across the southeast corner.
So what we've done is seen police handing out masks rather than fines to date. So up until this morning, our police officers in the community have handed out 360 masks. There's only been 4 infringements issued in the Brisbane area overnight related to this, and in 3 occasions those persons were actually offered the masks, refused to wear them, offered again, and then were given directions because they shouldn't have been out and about as they were, and then failed to follow the directions. So police were left with no alternative.
The government is also advising against panic buying as there are ample supplies to go around. Julia Bradley, Sky News.
Taking a look at Australia's coronavirus statistics, there are currently 303 active cases of COVID-19, including both locally acquired and overseas acquired cases. Of those, 41 patients are in hospital, no patients are on ventilators or are in ICU care. Breaking down that by states and territories, in New South Wales there are 197 active cases and 1 patient in hospital. In Victoria there's no one in hospital and 39 active cases. In Queensland there are 20 cases, all taken to hospital regardless of their condition, and that's as per state quarantine rules. In South Australia there are 12 active cases, no one is in hospital. In WA, 18 active cases, 1 patient is in hospital. And in Tasmania, there are 0 active cases. Moving to our territories, there are 0 active cases in the ACT, 17 cases in the Northern Territory, all in hospital, again due to the state's quarantine rules. and there are no patients in ICU or on ventilators across Australia.